What the city is talking about. This is Montreal Now on News Talk Radio, CJAD 800.
That is James Mennie over at the Montreal Gazette. So, Jim, let's start off with the Christian Dubé situation here. All of a sudden, the minister we haven't heard a whole lot from, back in the news a couple of times this same week, and at least is reacting. Maybe that's good news.
Well, it's good news insofar that we're finding out just how bad the situation is. I mean, we've discussed in the past, hysterically headline stories talking about a lack of resources or a lack of nurses or patients have to go to this hospital because this other one can't accommodate them. In the past 73 hours, the Quebec health minister has been obliged to reassure people that, no, don't worry. I know that poll says a growing number of Quebecers are turning their backs on the public system, but no, we're going to make it easier for you to get in, and we're going to make sure you get the full services in the system you're paying for. And then today, a little before 2:00 in the afternoon, he has got to point out to people, don't worry. If you have a family doctor, you're going to keep it. We're not going to reassign you. It's not going to happen. The problem is both these situations are based on headlines that are based in turn on what the ministry is in fact contemplating doing. They're thinking about doing this stuff. And I'm getting a really uncomfortable feeling, Aaron, that we're seeing a kind of whack-a-mole approach, which has been a hallmark of the Legault government. But one I didn't think that would extend quite so visibly to the health ministry. I always had the impression Christian Dubé was an administrator, that this is the kind of stuff he's not going to get caught short on. And here we are, like I say, two rather embarrassing admissions made by the health minister about the system. Don't worry, you'll be able to get a doctor. And don't worry, if you have a doctor, we're going to let you keep it. We're not going to take it away and give your doctor to someone who doesn't have one but who needs one because they're sick. This is the kind of conversation you don't want to be having in Quebec in 2024. It's really one you don't want to be having in Quebec that is headed, slowly but surely towards a general election. If this is what this government does when it comes to administrating the healthcare network, the $1 billion a week healthcare network, which is saying, that thing we said we were going to do 2 days ago, don't worry, we heard you freaking out, so we're not going to do it. That is not what you want to hear. And a lot of people, and not just older people, I mean, even younger people, I think, are scratching their heads saying, listen, if I have a job, I'm paying through the eyes with my taxes to keep this system afloat. And yet the last thing that system seems ready to do for me is be there when I need it. And if I do need it, God forbid, if I wind up in the ER, gee whiz, I hope that, if anything bad happens to me, it happens to me in an administrative district where the ERs aren't running at 250% capacity. This is no way to run a railroad, certainly no way to run a health ministry, and yet here we have Christian Dubé apparently, assigning his entourage to create these messages saying, like, don't worry, be happy, even though his own ministry is creating these headlines of despair.
It's kind of like that old idea, right? Run it up the flagpole to see who salutes. Here goes the idea, and then all of a sudden reactions there, and it's, don't worry, we're not going to do this. But it's like conducting an instant poll, right, that takes 2 days, and then the government just backs off, at least in healthcare.
Yeah, but that's great if you're trying to sell a soft drink, Aaron.
Exactly.
It's a bit less professional.
Yeah.
If you're trying to, if you're trying to, and that's the other thing. Do you really want to have a situation where, people already now, and we've said it on the show, and perhaps we're to blame for a certain extent. I've said it on air as well, which is like, you know what? My best advice for you to deal with Quebec's healthcare system, don't get sick. And that's always in the back of people's minds. I think if you did a segment in 5 minutes time saying, do you trust the healthcare system? I think we know what kind of calls and texts you're going to get. But all that said, they are. You can't deny that Dubé is trying to turn this massive iceberg-ripped Titanic around, but it's so difficult simply because the fundamentals aren't there even. The idea that a minister of a government has to turn around and say, those headlines you saw just 2 days ago suggesting you might lose your salary, don't worry about it. And of course, in the back of our mind, we're still saying, okay, but you did come out of your office 2 days ago, so what's to say you're not going to change your mind next week or next month? The fact is, you don't know that. All you really know is that the healthcare system, which seems to let so many people down in this province. It's not completely defective, but by and large, it is mistrusted. It is an issue of concern for so many people out there who rely on it. It's not getting better, and nobody, no matter what side of the political equation they're on, seems to have a plan to do that.
So let me move on from that. I haven't even talked about this, but I heard this going on this morning. I heard Vashi talking about this with some of her guests. 4 Liberal cabinet ministers today, not one, not two, 4, all at the same time saying, you know what, we're not going to be running again, which obviously kind of makes you wonder what's going to happen next Wednesday during the caucus meeting. Is there revolt? I mean, is this actually going to happen? Is Justin Trudeau going to be forced out? 4 ministers leaving on the same day. That's something.
Well, I mean, the thing is, if these were normal times, we'd say, listen, you know what? They've all been in cabinet since 2015. It's been a long haul. You can understand. Maybe they want to do something else with their lives. But now the fact that this is coming down, this is coming to the surface as perhaps as many as 20 MPs are circulating a letter calling upon Trudeau to leave, as it seems that perhaps there are more people in the party that we haven't heard from who are actually contemplating getting the hell out. There's no way, like I say, this should normally be perceived as something normal that happens in politics, and yet no matter what happens now, Aaron, between now and the next election, and who knows exactly when that's going to be, it all has a look of rushing towards the lifeboats. And that is not the position you want to be in, even if you are going to prorogue Parliament and leave politics and hope your party survives. The whole vibe you get off the federal Liberals right now is one that things simply are not working. And I heard you talking yesterday to my old boss, Joan Fraser, and to Anthony Housefather about this rather unusual, this welcome, but rather unusual endorsement from about 60 Anglo-Montrealers. Anthony Housefather is a great MP, and he is. I mean, I said he's a stand-up guy. He stood up for Anglo rights when a lot of his caucus members were just basically covering their mouths, covering their eyes, and seeing no evil whatsoever. The guy stood up, and yet when you look at that endorsement, there's nothing about endorsing the Federal Liberal Party. We're talking more about Anthony Housefather himself. And as I say, that is the kind of fin de regime vibe we're just getting off the federal Liberals. I don't see how anyone, even Anthony Housefather, cannot be negatively affected by that suggestion that, we're just looking at our watches, but sooner or later the train's going to leave the station and there ain't going to be anybody on it.
Jim, I want to wrap up by talking about this study by the Canadian Association of Canadian Studies at Jack Jedwab on before, showing that really the highest number ever percentage-wise, 65% of Canadians think our immigration levels are too high. This discussion is clearly not going away. The number has never been higher than it is right now. What do you make of this? I'm
surprised it's not higher. Given the amount of time, given the amount of shrieking headlines and dangerous populist rhetoric. And yeah, you know what? It's true. The level of immigration is too high. The level of when your immigration policy is based on what? My God, a 7 or 8 year old tweet from the Prime Minister saying, "Hey, come one, come all. We love you. Just come here, no problems whatsoever." When that is the basis of your immigration policy, you've got problems. We're paying for it now. And the trick now is whether it's Justin Trudeau, and I doubt that, or Pierre Poilievre, I doubt that even more. Can grab this bull by the horns and get things under control. Because on the one hand, guess what? We're not being nice by bringing immigrants into this country. We're keeping Canada alive by bringing immigrants into this country. So somehow someone's got to square that circle. I see no indication from anyone they've got a plan yet. But it does not surprise me that the number is that high. It probably will go higher, and I can only hope that the concern expressed by those respondents is not tinged with anger, because I don't like the way this whole debate is going.
It's about immigration, not immigrants themselves. I just want to ask you, when you bring up the Conservatives, what's the Poilievre stance on immigration? Because I don't know.
I'm not really sure about what it is either. He says it has to be controlled. He says we have to get things under control, which is fine. That's marvelous. But where do you start? And who do you start with? And how do you deal with people like Francois Legault, who have decided to turn immigration into an existential threat to Quebec identity? we're getting to. We've always had problems with people who didn't like the idea of immigrants. You're right, but now the whole issue of immigration is being equated to a certain extent with a threat to this country's future, and I think that's a very, very dangerous place to be.
James Mennie, Montreal Gazette. Thank you, Jim.
As a man.